Hey, nurses out there.
Well,
This is Jana Price for another episode of Nurse Converse on Nurse.org. Today, we have an incredibly special guest. This is Dr. Jennifer Mensik Kennedy, and she is the president of the ANA, or the American Nurses Association. We have her on today, guys, because we have to chat about something that is incredibly important. It's affecting quite possibly every single nurse out there. This is an issue that is right up at the front lines. And we have Jennifer to come on to chat with us about how it's going to affect nurses. What is this going to look like for nurses in the future? And Jennifer, I'm going to get to introduce you in just a moment, but I want to go
yep.
ahead and just bring a little bit of light. If you guys don't know, we're going to be talking about the loan limits that the Department of Education has put on graduate nursing as degrees. And this issue is, if you haven't heard already, let's go ahead and talk about it now. The Department of Education under the Trump administration and the big beautiful bill has now put loan limits saying that nurses seeking graduate degrees cannot take any more than $20,500 per year or an aggregate loan limit of $100,000 total. That's a big deal, right, guys? All right, I've got your attention. So, Dr. Jennifer Mensik Kennedy, thank you for coming on. And I really want to just let you take over now because you are it. You're out there, you are fighting the fight for us. You are standing up and representing nurses. And the ANA, along with your leadership, have come to the forefront and said, this is not acceptable. So, today we're going to dive into that. I want to start out. I know I've given a brief overview, but is there anything else you'd like to add to that so that nurses out there can get a really clear sense of what's at stake here?
Oh, there's a lot to add, and thank you for having me to talk about this really
Absolutely.
important issue. So this is great to be on with you. There's a lot to be considered, and I think it's a little confusing. Kind of people are like, "Well, what does this mean for me, and how will this impact me?" And I think there's a lot of misperceptions currently, and so I know through all the questions, we'll probably be able to help people who are listening be able to understand how this might impact them.
Absolutely. Now, in the statement that you guys can go to the ANA's website, you can see the full statement that they brought out. And please take some time and go to do that. But I want to kind of pick that apart a little bit. And I want to start out with ANA's came back and said that the department's logic is quote unquote flawed and out of step with clinical realities. And it's dismissive of the role nurses play. Can you elaborate on that and kind of tell us what you guys were trying to convey with that statement?
No, absolutely. So, we've been watching this since this started to gain speed over this last summer, and we really assumed, and also assume is I guess a harsh word, but we've always been included kind of under this very open definition, but we were watching very closely because we knew they might change some of the definitions related to, who should qualify for these higher loan amounts. So what happened was through HR1 that was passed in July, the Department of Education went ahead and created this RISE committee, which was to look at who qualified for different loan amounts. It's, very clear, goes going back to Project 2025, that they want the federal government out of the business of school loans. And so this was one step towards that exact issue. So the committee pulled together. We actually advocated for a nurse to be on the committee, but of course, a nurse was not chosen to be on the committee because people don't understand nursing. And when it comes to the definition that they left, so the original kind of definition goes back to 1965, and it says, physicians and others, but it specifically says this was not an exhaustive list, right? When that definition was written, it left it open. It says this should not be considered the end all be all of this list, but others may be actually included in this. Now, also keep in mind what happened in 1965. It's the first nurse practitioner. So when that initial definition was created, nurse practitioners didn't even exist. And so we, from a flawed perspective, looking at just the changes in healthcare, the positions and the utilization in our system and the clinicians, where we were in 1965 to where we are now and what our healthcare system needs to be able to provide care to patients. So looking at it from that perspective, but also that short-sightedness that says, nurses don't qualify, so advanced practice nurses shouldn't get those advanced loans, is just going to really hurt the system when we have other departments in the government who are trying to encourage advanced practice registered nurses at the same time in rural health and in other areas to get out there. So it's kind of interesting that we've got different departments at odds, one wanting advanced practice nurses and the other one basically saying, we're not going to give you loans that are going to fully cover your education.
Absolutely. And to think where we are from 1965 until now, from one nurse practitioner to, I'll say it, I only see a nurse practitioner for my care. That's who I seek for my care, and nothing against physicians. But as somebody working in nursing, the amount of nurse practitioners and advanced practitioners is crucial in this day and age, especially in those underserved communities. So I'm glad you brought that up about the 1965 and where we've come, because we went through 1965, and let's go ahead and say it, we went through COVID. Now here we are,
Absolutely.
and
Yep.
it is so important for nursing. We could do a whole episode on that, how much nursing has advanced and how much it means in this day and age. So, well, here we are. Now we're in this position, like you said.
Yep.
The nurses are wondering come July 2026, are we going to get the education funded? When you guys heard this statement and it came out, what was the first attack that we took? What did the ANA, what did Dr. Jennifer Mensik Kennedy say was the first step we had to do?
In the fall, what we did was when we knew they were meeting, before they were going to, kind of put out or float out what they were thinking, we did send a letter. And we sent a letter with in partnership with 70 other organizations. This was a very coordinated effort that says, here's why advanced practice nurses need to be included in this definition. And here's why they actually fit very cleanly and very neatly in this definition. Of course, they put out some of their initial wording and people were like shocked, right? They did include clinical psychologists. So they could have added, and they did add, they added clinical psychologists. So we launched the petition. We had over 250,000 signatures are in action, urging the Department of Education to focus in and allow the advanced practice registered nurses to have that higher loan amount. And so they ended up, right? So there was a part where we thought, well, maybe before they publish their rule for public comment, they'll change it, right? Well, what happened was they put the comment out for put their rule out, and they had not changed it, right? So we're like, okay, they aren't changing anything. And what they did was, and we can talk about this a little bit too, they went ahead and explained why APRNs should not be included in a couple paragraphs. From that, we coordinated further congressional action. We have had 140 members of Congress, I think we're up to maybe 150 members of Congress, sign a letter urging the Department of Education to add advanced practice registered nurses. And this is a very bipartisan effort. We have Republicans and Democrats and independents who have signed on. We have had through very coordinated congressional action. We've had our nation's nurses send more than 17,000 emails and actually make more than 1,500 phone calls to
Wow.
their Congress people. Exactly. And so
Wow.
we also, through RN Action, had more than 14,000 comments submitted, which shows how important this issue is because every letter matters and every call matters. And so we're hoping, right? So now that 30-day period has closed
Mhm.
and they are supposed to review and look at all of the comments and questions and everything that they got. And then they put out their final rule. That final rule then goes, the Department of Education administration can make changes, right? They can still do something. But if nothing changes, then it would go into effect July 1st of this coming year.
Wow. So that's a lot to take in. So here we with public comment, that was
Yep.
going to be my next question. How did the public comment go? But that's
Yeah.
awesome. We had engagement. We have
Yep.
nurses getting involved
Yep.
because this is really important. So in a perfect world, something would happen before July 26th. I'd say,
Yep.
just kidding.
It's a
We
perfect world.
yeah, in a perfect world. But up until July 26th, we're in a waiting period to see, have these lawmakers listen, have the people, the powers that
Yep.
be taken a step back and said, listen,
Yep.
obviously nurses are speaking out and this means something. So
Yep.
we've chatted about what happens in a perfect world. Let's talk about what happens if it's not a perfect world.
Yep.
Come July 21st, 2026, and this goes into effect.
Yep.
Overall, high level look over here and kind of a bird's eye view, excuse me. How is this going to affect nursing right off the
Yep.
bat?
Yep, absolutely. And what we're already seeing effects of how this is impacting nursing, right? We're seeing people who are questioning whether they can afford to go to school. And keep in mind, federal school loans are important because, we see a majority of our minority communities
Mhm.
who need higher levels of loans, who don't maybe
Mhm.
have the family income who might be able to help pay. We've seen research published in Health Affairs recently that said in Michigan, a study showed that 29% of advanced practice nurses had loans over $100,000. So we know this is a
Right.
large portion of advanced practice nurses. So we're seeing people question whether they're applying, applications for fall enrollment are open, and people are really thinking
Uh-huh.
about what they can do. And this is a shame because not only will it impact, APRNs, the NPs, the
Right.
nurse midwives, the CRNAs, and our CNSs, but this will impact nurses going back for their PhDs and their DMPs who can teach, right? And master's
Absolutely.
degrees that can teach. And also, there is a whole cohort. There are 10,000 nursing students who are doing a master's entry program into being an RN, and this will
Right.
impact those as well. So this will have, an impact on people who want to go to school and people who want to become teachers to teach the future level of nursing. So this is going to have a massive impact that we're not going to feel if nothing changes. We're going to start to really feel this in a few years. We're going to see
Ah,
the impact
without a
of
doubt.
less providers, less nurses graduating, and it's going to take decades to make up for what's going to happen. This is really scary, actually.
Honestly, I'm sitting here thinking about so many nurses go into nursing school knowing that they want to go the full way. They want to start out in nursing school. They want to go seek their higher education, and in order to do that, you have to complete nursing school, bachelor's. Most everything needs a bachelor's. You can go ADN, BSN, and then you have to move into that level of care. And that's not to mention taking these loans out. We have families. A lot of us go back to school like I did with two kids, and we have to then you want to serve these underserved communities that need the help that they are begging to have providers come in. But now we've got this huge barrier that says, yes, we want you to come into
Yeah.
this area of nursing that's underserved, but good luck. We're not
Absolutely.
gonna we're not gonna help we're not gonna help pay for it, and you're gonna have to
Exactly.
figure it out yourself. But yet they need this type of help in within the United
Absolutely.
States for all sorts of care. So that's just, disheartening, and like you said, it's very scary.
It
And
is
it and
scary.
it
And so many advanced practice nurses and nurses who go in those underserved areas do so with loan forgiveness programs through the federal government.
absolutely,
And the
absolutely.
important part to remember is if you are a nurse who also has to get private loans, those federal loan forgiveness programs will not pay your private loans.
That's right.
And so it's even more detrimental than I think people realize. They're like, well, I can get private loans. Yeah, but they're not going to be forgiven through those federal programs.
No, they're not, and that's where a lot of people get in trouble. So, well, this brings it to another question. We know that this is not good, but we know the Department of Education is saying that we need to stop these loans. Is there anybody else who is against this stance? We just want to let's cover both sides. Is there anybody else
Yeah.
who is out there saying, "No, we
Mhm.
agree with the Department of Education"?
Well, I think so. What I've heard, right, is nursing school is expensive. And,
Mhm.
I'm not going to argue that, anytime we spend money, we want to do it thoughtfully. I, went through school completely from I was an LPN, I was an ADN RN, a BSN, all the way through my PhD. And 13 years, I had over $100,000 of school loans. Now, I graduated like my finished my PhD 20 years ago, and I had that amount of school loans back then. So cost of education has increased, right? And I think people, when they say, well, if we cap loans, then nursing school will become cheaper. But I think what people don't recognize or don't think about is nursing schools, state to state, are funded in part by state appropriations. And so it really has a lot to do with how much taxpayer dollars are subsidizing or coming into your school of nursing. Some states have lower tuition, but that means, right, that there's more taxpayer dollars going into that university to help fund that education. And when educational programs are higher, that just means less tax dollars are available. So I think the thinking of if we cap loans, nursing school will become cheaper, I think is a very flawed perspective. And that if we want to look at nursing school being cheaper, this is not the way to do this. I don't know
No,
one faculty member making a bunch of money.
I was just about to say, I don't think anybody in nursing goes and says, "I'd wanna join nursing to become faculty member because I'm gonna become rich." It
Because
is
I'm going to
it's
take a
absolutely
50% pay cut.
exactly. Way more money at the bedside with overtime.
Yep,
That's a
absolutely.
very interesting perspective because the Department of Education is saying that they want to have this as a way to discourage them from raising tuition, hiking up tuition in nursing schools. But the situation where we really need nurses out in the field as the population grows, and let's just be honest, as the population gets sicker, we're
Absolutely. And
as we
older.
get sicker and
Yep.
older, the care needs are rapidly changing, and in
Yes, they
order
are.
and I know that people like to say that and it is true, nursing school is expensive, but you know what? You pay money for something that's of value,
Yes.
and a nursing degree is of value. It is
Yeah,
something that has served myself, many nurses, and you. We're out there changing and saving lives. I
absolutely.
can't think of a single person who I could say here is a nurse who went to a really cheap school, and here's one that went to which nurse got the best education and which nurse was taught how to take care of people with love and compassion, but also with skill and excellence. And if you want that type of a nurse, I get we have to put a cap on education as like you said, spending money is important. You want to know what you're putting dollars, but we're talking about people who are going into the workforce, who are saving lives, bettering lives, helping people. So I think we have to also take a look at that through the Department of Education. We're not trying to make nursing cheaper. We're trying to make nurses the best possible people that we can put into the workforce to make America a great nation through the care that it receives through nurses who care the most. So now this is in if you want to add on that, please
Well,
that we could do a whole podcast
we
on,
you
on
could, well,
that.
and there's so many inequities in nurse funding education in this country. I mean, so we did get Title VIII
Right.
put back in this last month. So
Yeah.
Congress voted for Title VIII. So we got our funding of a little over $300 million a year. And just to put that in perspective, it was taken out of HR1.
Yeah.
Congress, very bipartisan action, are very part both sides of the aisles, voted because they knew how important nursing education dollars were. And so voted, to bring it back in. We have $300 million that goes towards nursing education, which goes to schools and others. But it's really important to note, like, we're a drop in the bucket. We are the backbone of the healthcare system. We are the largest body of people providing healthcare services. And what we have is the physicians who were also capped, in the professional loans, and they're going to have some issues, but they have graduate medical education dollars. We're talking billions and billions of dollars annually to help fund further education. And nursing is over here with maybe $300 million, and we have a small group of providers, the physicians, getting billions of dollars annually. So I think if we really want to look at the cost and look at things, we have to relook at how we do the whole system. Not just penalizing nurses and advanced practice nurses.
Exactly, because like you said, we are the backbone. A
Yep.
hospital, no system can operate without a nurse. Great,
Yep.
doctors writing the orders, but who's going to carry it out?
Yep.
That's always been my question.
Absolutely.
And which now
Absolutely.
the Department of Education is essentially saying that the APRNs that they do not classify, now they're saying this is not a professional degree. However, let's talk about the scope of an APRN. Let's talk about the scope of a graduate nurse for a minute and somebody who has APRN goes and gets their doctorate and they are operating. Everybody out here listen to a nurse who is a nurse, you know exactly what an APRN does. And but let's for the people who are not nurses who are listening to this right now, go ahead and classify what an advanced practice registered nurse does.
No, absolutely. And even first, what the Department of Education said about RNs. So they made a comment in their statement in their 6 paragraphs that stated, not unlike RNs, APRNs must be supervised by physicians. And so two flawed statements, right? Right there, it tells us they don't even know what registered nurses do with if they think RNs are supervised. And so there is a component of practice that we can do that's not our nursing practice, right? Where we take,
Right.
we look at orders, we implement orders as RNs, whether it's in the hospital or home health, but we are completely independent. And so much independent. We have a law that we passed in Oregon where RNs this coming year can bill Medicaid without providers' orders for services within their scope of practice. So, taking that to advanced practice registered nurses, right? We have NPs, nurse practitioners, a nurse anesthesiologist, we have certified nurse midwives, and our clinical nurse specialists. These all have different specialties in which they focus. And I think most people know what a nurse practitioner is. But we have 30 states and territories where RNs have completely independent practice. We have 11 that have totally restricted their practice, but it has nothing to do with their education and their ability. The research shows decade after decade since the 1980s that care provided by APRNs by NPs is as good as primary care providers and physicians, if not better in some circumstances. And so that's why, we've already done this work to have advanced practice RNs being able to bill our Medicare system because Medicare wants to know that the care is good. And we know decades and decades. We know in 30 states and territories, you know, nurse practitioners aren't supervised, don't need this type of level. So, because state politics exist, there is some supervision issues, and we're all working to, go through that. The Federal Trade Commission even said this is a restriction of trade from a state at state levels when we stop them from practicing to their full extent. So we have multiple government
Wow.
agencies who acknowledge that NPs and other advanced practice nurses should not be restricted. And NPs too have a different role, right? My mom is a nurse practitioner. She is a family nurse practitioner and a psych mental health nurse practitioner. And she
Mhm,
focuses and practices within that
mhm.
scope of family and psych mental health. And as does every advanced practice registered nurse. And so
Right.
she's very lucky that she gets to practice in a state with independent practice, though, too.
Absolutely. Both my parents are CRNAs and
Oh,
advanced and
wonderful.
I think about and as many times as I've had surgery, of course, a doctor might come in for a second, come out. CRNA runs the entire case, the entire time. They are professional. And like you said, we've got these nurses in the independent practice. There are currently, I know of one called Nurse Connect where it's a platform within the states that a registered nurse can go on and essentially hire out care within their practice and go and perform in the community things that maybe they can't get within the system or, Medicare has its barriers. You can actually go out as a nurse and operate within your scope and do simple things like that. So to say that nursing, here we are fighting the Department of Education to say, no more money, no, we're not going to give you more money, but the communities, the nation is begging for more nursing care. So let's bring it to this. And I want to ask this, and I know this is something everybody's thinking. Do you think that this is really more of a financial issue that we're facing, that this is really a financial aid type of let's cut down the money? Or is this trying to limit nursing as a profession? I think that's what it will do. But where's the disconnect and where do you think one is greater than the other? Are they coming together? What's your take on that?
I think they're coming together. I think, we know clearly that there is a lot of work to get the federal government out of certain programs and to not have that funding. They don't want to be involved in school loans at all. And so I think what people need to think about is this is the first step probably in many steps if this is successful to really cut back and have the government remove themselves. And, people might think, well, there's still private loan options out there, but they're usually much higher interest rates, different types of repayments. They don't qualify for it. We really need to kind of step back and to look at this. And I think what's important, and I think I've got four high schoolers right now, like this is going to have a trickle down effect to all of our kids who aren't even going into nursing because now there's going to be even more competition for scholarships and others to try to bridge those gaps. We have advanced practice registered nurse students who want to get loans, who will make the money to pay back their loans. They do not default. They're the best payers. And we're going to tell them that they can't get the loans that they need to go back and serve the communities that they need. So I think this is an effort to remove the government. Unfortunately, there's not great options left over for people who do need loans to be able to go back to school. But also, I think it is in some effort to limit advanced practice nurses in some areas. I think there are definitely groups of individuals, what's reason why we still have restricted practice, full restriction practice in 11 states. There are people who don't want to see APRNs be successful.
Understandably, that doesn't make it right, but
Nope.
There's always the kickback there. As we go through these changes, are there any other policy or regulatory changes that you think the ANA would support that they really want to get behind that maybe some of
Hmm.
our listeners could get behind as well if they're thinking about getting in a little bit more involved with this?
Yeah, absolutely. So I would say, a login, you go check out rnaction.org. You don't need to be an RN. You don't even need to be a nurse or an advanced practice nurse to go in, sign up. And what you'll do is you'll get alerts and you'll see the momentum, you'll see the calls. We're waiting for that final rule to come out. And I want people to know that just regardless of what happens, so if the final rule comes out and it's not in our favor again, that's not going to be the last of this, right? That we are currently working with our coalition partners on a very large laundry list of actions that we can take and to look at if because we're not going to let this kind of just rest as it is if the Department of Education doesn't change this. And so I want people to have hope that we're going to continue this fight, which is why people need to join in and log into RN Action and sign up so that you can see the alerts, you can see what we're up to and see where we're going with this. This is really, really important. And also, you're going to learn about things what we're trying to do, such as the ICANN Act. So, the Improving Care and Access to Nursing. And the ICANN Act is removing outdated federal level barriers. So, COVID, right? We had a lot of emergency waivers where advanced practice nurses could magically do things and have this full scope with the federal government, like sending their patients directly for diabetic treatments and other stuff. But when those emergency waivers sunset after COVID, those rules got put back into place. So ICANN has wide support. We actually think this has probably the biggest chance of maybe making it through Congress. We had over 400 organizations support this. We've had AARP sign in favor of the ICANN Act. And so this is, got some really good momentum. And again, this is one component of the overall pieces because it's not that they don't have advanced practice RNs don't have the education to do this. It is just outdated barriers and regulations, which we know this administration wants to remove. We have a bill of regulations we want to take off that get rid of to make healthcare much more easy and affordable for people. And so the support of the ICANN Act, I think, will make a big, big difference. And so, you can also track that, watch that, and see how that's going amongst a lot of other bills that we're watching related to workplace violence, whether we're looking at faculty loan repayment programs. So we've got many bills we're looking at because it's really important to make sure that we support nursing, the advanced practice nurses, and the community, because at the end of the day, all we want to do is provide quality patient care and make sure the health of the public is strong. And, just let us do it. We'll do it. We just have to get there.
We just need the strong nurse. We need the support and of the nurses. We need a strong backing in order to provide that strong care. And all of those things that you mentioned are just so important. I myself am really involved in the workplace violence arena there, really getting out there, trying to get involved politically on the Hill, getting these things brought to the attention, which is a good question I want to ask. What is the final language? What is the final word that ANA would like to see regarding this proposal on, let's just say, in July of 2026? What is the perfect language that we want?
Perfect language would be to include the advanced practice nurses as a component of this, because that's all we're asking is that the advanced practice nurses are included in that professional level, that higher level.
In order, we want nurses to continue to get engaged in federal policy and discussions. And this is a great way to start, right? And like you said, you've led us through. Here we go. We're going to get involved. Guys, if you're listening, we're going to have links to these initiatives, these programs, these policies, these changes that Dr. Mensik Kennedy has talked about. But how do we encourage nurses that this is not the end all be all? We need as many nurses as possible to get behind in order to have. We've just talked about we want to create strong nurses within our nation. We want to keep strong nurses within our nation. And we want to facilitate that, grow that, and keep that. And in order to keep that, I would love for you to touch on how important it is for nurses to become involved any way that they can, whether it be politically or partisan, however you want to get involved. I hate to use the word political, but in a way that's going to create legislation and laws that are going to further profession. I'd love for you to touch on that to give some encouragement to our nurses out there.
No, absolutely. Our code of ethics states we have a responsibility to be engaged and to be advocates, not only for our patients, but for ourselves, our profession and our system, and to be diplomatic through those actions. I've heard nurses say, well, nurses shouldn't be involved in politics or policy, but I want people to stop and think that everything that you do during your day is couched and is within a policy someone else created. Every person lives every day in many, many policies. And those policies were not created by nurses and not created by you. So the suffering and the work that we do gives us moral clarity on what needs to be done and what needs to change. And this is for our patients, right? There's nothing, whether it's your license, whether it's staffing ratios, whether it's the scope of practice of an NP, all of this is set by policy and politics. And nurses know what needs to be done, and you need to use your voice. And so you can start locally, you can join your state association, whatever state is, and you'll become a member of American Nurses Association at the exact same time. I've been to several lobby days where nurses, I was in Wisconsin, we had 800 nurses attend lobby day in Wisconsin, go to the Capitol and talk to their legislators about issues that needed to be changed and needed to hear. And the legislators need to hear this. I remember having a conversation we have 3 nurses in Congress at the federal level. And I remember having a conversation with Lauren Underwood. She's a registered nurse out of Illinois. She's in the House of Representatives, and she's one of the chairs of our nursing caucus at the federal level. And she said, the problem is I fight for nursing and I create bills for nursing, but I never hear from nurses. She goes, I don't know what you want if you don't tell me and if I don't hear from you. Am I doing the right things? And so everyone should join RN Action. You should be reaching out to your state level members, right? Whether it's the House or the Senate. You need to reach out to your federal members. It doesn't need to be extensive. You can send an email and just say, here's my experiences, because people need your experiences. They need to hear your voice. They need to hear what happened, from a workplace violence perspective, where I was injured and here's why we need protections, or here's why we need safer staffing. Here's why we need, protections, and we need removed regulations for advanced practice nurses. So they need to hear from us, because if they don't hear from us, right, everything's fine. And that's not the message we
Absolutely.
need.
No, and in the beginning of the podcast, you talked about that you would ask for a nurse to be on the committee. There's no nurse.
No. Yeah.
We're sitting here and you say it out loud and it almost stings a little bit more that the people making these policies have nothing to do with nursing. We don't even have a nurse representing us, but yet is affecting the millions of nurses in America. That alone should shock every listener, that the people making decisions for us, not one is a nurse. And that has to change. That has to change.
We might be the most trusted profession, but we are not the most respected. And
Absolutely.
we will be respected the day people never forget to invite us to the table.
Oh, from your mouth to God's ears. That is that is so true, and I have to say, I interviewed a mayor not too long ago of Plymouth, Michigan, and she's an oncology nurse, and she said something that just really changed. She said she was so confident in saying, "The skills that I have as a nurse, that
Yes.
I use at the bedside," she goes, they're the same skills that you need to run a
Yes.
town and take care of
Yep.
a community. And that resonated with me so hard because she is a very experienced, valued nurse at the bedside dealing with cancer patients. And she is now a leader of an entire town in Plymouth, Michigan. And I thought, what, let that be a testament to the nurses out here that, guys, the skills that you're doing every day in any job that you have, if you have RN behind your name, I don't care what you're doing. If you have RN behind your name, you have the skills to go out and make changes, not only in the patient's lives that you deal with, but in a level that's going to take care of the nurses' lives as well. So very, very
Absolutely.
important.
You're going to naturally just bring AdPi to every solution and
Yes.
problem, right? You're going to bring the assessment,
Exactly.
diagnosis, planning,
Nurses.
intervention, evaluation.
Yeah, nursing school care plans just hit me about that time too. You said that. I haven't heard ADPI until the actual word until 11 years ago in nursing school. But it's so true because I don't
Yes,
need to hear the word. I do it every day. I don't
you
even work
do.
bedside anymore, but I work in med device. Every day I use my nursing skills in the same job that you can. Nurses, if you try to leave bedside, good luck. You're gonna take all those skills with you. It'll never, ever leave you, which is the
Absolutely.
fantastic and wonderful and beautiful thing about nursing. So,
And so they
I
should run
wanna
for
yeah.
Congress.
Exactly. We're gonna do an entire podcast with you on how we're gonna get these, nurses out there to do that, but I do wanna ask you, I wanna start wrapping up, but I wanna ask you, for anybody out there that's listening that, may not be on our side, that may be in Department of Education, are there any misconceptions that we have not covered about the nursing professional status that you wanna correct on a federal level? Is there anything that we haven't touched that we really need to get out in the open so that we can deal with this?
Yeah, I think when the Department of Education said, well, advanced practice nurses are supervised. Well, they don't have to be. That is due to some outdated barriers at some of the states that we are actually working through. And, we're over 50% of the states have full practice authority. So if we want to continue to have the best healthcare system, we can't act like we're in the 1965s. We have to look forward at what we need for the future and continue to move that direction. And I would hope they would listen to all of us. Hope would listen to Congress, listen to all the nurses, because there's not one of those people probably on those committees who has not been taken care of by a nurse. I think the magical thinking that schools of nursing will automatically be cheaper. I've talked to so many faculty who they're new graduates that they just taught and graduated are making more money than them out, right after graduation. So where is this cut, right, coming from? Because we need people. We can't cut faculty salaries. Schools of nursing do have very, restricted ratios because we're training nurses in very dangerous situations. So you need faculty oversight in clinical settings. So the model of education, is there to protect the student from making a mistake. It's there to protect the patient from mistakes, but also to make sure those nursing students, whether it's an advanced practice nursing student or, an unlicensed nursing student, right, that they have the best experience and the best education so that they can have positive effects on our healthcare community. We're not asking for free education, right? We're just asking to borrow the money that we will pay back to be able to serve the communities.
It's a question that I would have to ask anybody in legislation or anybody who would oppose this. Like you said, there's probably not anybody who hasn't been taking care of a nurse, but let's just pretend that you haven't. You will age. There will come a time that you most likely will be hospitalized. You most likely will need care or God forbid your loved ones, your kids, your grandkids. In that time that you're sitting in the hospital and you're receiving care, I would hate for the question to be, how good is my nursing care considering that they had to jump so many hoops or that there's not enough care, that they're so short staffed because they don't have enough people to care for because the cost of them wanting to get an education to care for other people was unattainable. And now that reflects the type of care that I'm going to get as I get older and as I age and as my children and grandchildren enter into the healthcare system? That's a question that every single person, we all in nursing see it, we know. But if you are not in nursing and you are out in another field, maybe you also need to come and start
Yes,
advocating for nurses. You don't have to be
absolutely.
a nurse to advocate for us. You can
Yeah.
come and look at this from the fact that you, at one point, or a loved one, without a doubt, will be someone who has to come and use the healthcare systems in the United States of America. And we as nurses want to provide you with the best care that you can possibly get. We don't go to nursing school and into these fields because, oh, hey, I can speak for most. I generally love taking care of people. I generally love the profession and I really want to help. And this is most nurses. So think about that as you go into the hospitals and go into the healthcare systems. Stand up with us. Stand up for us. Speak out. Don't your daughters, your granddaughters, and everybody who's nurses, do it for them, but do it for yourself. Go and advocate for yourself so that you can receive better care. So that's my soapbox on there. And I have absolutely loved having you on. You've really clarified a lot of these issues. You've really given nurses something to really think about. Is there anything else you want to add in there that would be beneficial for our nurses out there listening today?
Well, I think one thing I tell people, and I did receive a lot of emails from people who are not nurses saying that they're supporting it and they're emailing their member of Congress, which I'm very thankful for. But I think people think that somehow magically the physicians, the supervision piece, that for nurses out there, I want you to think about the fact that we're not on one continuum or one ladder where physicians are at the top of the ladder and the nurses and nurse practitioners are mid levels, right? Because I hate the word, if I don't say the word mid level to me at all because they're not like what is it RN low level then. I want people to know that nursing is on a completely different ladder from physicians and
It
from
is.
those who in medicine, and it's not the same ladder, and we work collaboratively, and I want to make sure every nurse
Absolutely.
knows that and embodies that as well.
Absolutely. I love that. Thank you so much for sharing that. That is absolutely true. And all you young nurses out there listening to this, that is please take that as one of the key pieces that you put in your pocket as you move through your profession. So
Yeah.
well spoken. So as we move on, we're waiting till July. We hope something might happen before then, but come July, we're gonna have some check back ins. We're gonna see what's going on. We're gonna assess from that situation. We're gonna diagnose. We're gonna sorry, we don't diagnose, but we're gonna prepare ourselves to either really rejoice and celebrate together that we've got what we want, or as nurses, we're gonna come together and we're gonna say, all right, what are our next steps? So, everybody out there, if you're listening, I want you to go to Nurse.org's website. We're going to give you the resources that you need to have in order to catch up where you need to be caught up, where you need to join.
Um,
If you're not a member of the American Nurses Association, that's step one. Let's get
yeah,
that done. Let's get on American
absolutely.
Nurses Association, sign in, join, and then let's get involved in the things that Dr. Jennifer Mensik Kennedy has talked about today. So once again, I want to thank you so much for coming on. It's been an absolutely wonderful time getting to know you and getting your feedback and your expertise on this. As always, we're going to stay closely connected with ANA so
Absolutely.
that we can update our nurses as what's going on every step of the way. So thank you again for joining us.
Thank you for having me and talking about this issue. So important.
Absolutely. All right, nurses. Once again, thank you for joining me on Nurse Converse with Dr. Jennifer Mensik Kennedy. We loved having you on and stay safe out